There's a lot of different ideas being floated around about how to get inflation down. Probably one of the worst I just heard in the last week or so, floated by a couple different Democrats, of creating a national price gouging law. Horrible idea. I'm going to give you some examples of why this is a bad idea that we've actually seen here in South Carolina. So inflation hurts everybody. There's no denying that. Nobody likes inflation. The Federal Reserve is doing everything they can to try and slow down inflation by raising interest rates. That discourages economic activity. It discourages people from borrowing. So hopefully there's less economic activity. So there's less money being spent and inflation comes down. Well, now there's been a proposal put out. Elizabeth Warren was on CNBC last week promoting the idea of a national price gouging law. She said there's 37 of the 50 states have these laws. Why can't we have a federal law? Well, there's a lot of different reasons why. An estimate lives in South Carolina. We have to deal with hurricanes, and we have one of these laws. It's not a good thing. It leads to unintended consequences, and the biggest one is usually scarcity. I'll give you a couple of specific examples. First, let's say a hotel. If we have to evacuate here in Sumter, I looked the other day online and I found a hotel in Powdersville, South Carolina. It was a Comfort Suites that had a room for $102 a night for Labor Day weekend. What, $102 a night? Heck, I'm going to get 2 rooms. That way the kids can have their own room, Mom and I can have our own. We can have a little bit of space and a little bit of privacy. Not even give my mom to come along. She can kind of help watch the kids. But if there were no price gouging laws and the room was $300 a night, we're going to get to know each other really well. We're going to be piled up in there together. That creates another room for someone else. So that price gouging law eliminates space for somebody else that may need to evacuate. So what we've done is we've created scarcity. Well, what if I'm a fuel service and I have large tanks of gasoline that I store and I have trucks that deliver it to gas stations all around town? And I hear that there's a hurricane that struck Charleston and they're desperate need of fuel. Well, I've got the trucks, I've got the fuel, but it's going to cost me to get it down there. And if I can't raise my prices in order to cover that cost, maybe I keep the truck sitting in the parking lot. Scarcity. Or what about like Simpson's Hardware, for example, here in town? They planned well ahead in the summer and they ordered a whole bunch of portable generators, hoping that a hurricane wouldn't come, but if it did come, they would be ready to sell these generators. Well, let's say that a hurricane comes and instead of hitting Sumter, it hits Horry County, and they're in desperate need of these generators. Well, they could put them on a truck, but then the cost of the truck, the cost of the fuel, the cost of the employees to drive it over there and help distribute, and they have to put them up in a hotel room. Those are all extra costs. They're going to have to charge more for those generators. Oh, but wait a second, we can't price gouge, we can't raise our prices. Guess we'll leave the generators sitting here. You see, one of the problems with the way these laws are implemented is they're really vague. The South Carolina statute, the way it's actually worded, it says that you cannot charge an unconscionable price when there is an abnormal disruption of the market. How do you define that? Who gets to say what is an unconscionable price? I don't know. That's the biggest issue I have with these things, is some bureaucrat somewhere is deciding what the price of a good is. Anytime you remove the person that is receiving the good from the person paying from the good, you're going to lead to problems. We already have a massive system in the United States like that called our healthcare system. Me as a patient, I don't get to decide what it's going to cost if I go to the doctor, and frankly, the doctor doesn't get to decide what he's going to charge me when I go to the doctor. An insurance company or maybe Medicare, someone else is deciding that. How's that worked out for us? See, anytime that you separate those services, you lead to problems. There was a Harris survey in 2023 that surveyed a bunch of Americans about their, how satisfied they were with their healthcare system. 70% were disappointed with their healthcare system, and it felt like it had let them down at some point. I want to do that with our food and our housing? That's crazy. Profit margins are already really small for the grocery store. I've heard that some things that can be as low as 1 or 2%. Dollar General just came out today with a horrible earnings report because people are buying more food in their stores and not Household goods. The household goods margins are pretty good. The food margins are bad. So you're going to hurt those people that are trying to provide food by cutting their profit margins and telling them what they can charge and what they can't. This is going to be a disaster. Instead, we need to encourage more farming. We need to encourage our farmers. We need to cut back on regulations of getting the goods to the stores, getting the stores to the people. So we need to encourage housing. We need to encourage building more houses, building more apartments, not making it where you limit how much money somebody can make off of it. It's a bad idea, folks.